is what we call neuroplasticity.
Taub's technique developed because he had spent years doing a form of research that involves something called deafferentation. Afferent nerves are basically like sensory nerves that feed information from the limbs to the spine. Ed Taub deafferented some monkeys so that they couldn't use their arms. Then he decided to take their deafferented arms and put them in slings.
This is a unilaterally deafferented animal. The right hand is deafferented, the right arm, and the left arm is normal.
You deafferent one limb in a monkey, and the monkey doesn't use that limb again. However, on the basis of this really rather short intervention, 1 week, placing the animal in a restraining device that prevented him from using the intact arm, he began using the deafferented arm, and then when you removed him from the restraining device, he would use the limb again for the rest of his life.
When the animal is very hungry, we can increase his motivation sufficiently to try and force him to use the deafferented limb. With adequate training, deafferented animals were capable of carrying out virtually every major category of movement.
Taub was now very excited because he wondered if this thinking could now be applied to human beings who suffered strokes.
If you could get the same result in human beings after stroke, you would then have an enormously powerful and effective way of treating stroke and traumatic brain injury and other types of damage to the central nervous system in human beings.
Keep going.
It turns out that Taub's technique is good for many conditions beyond stroke victims. He's used it with people with all kinds of brain damage, including soldiers returning from Iraq, people who have had their brains damaged by chemotherapy and radiation. It's even been used with children with cerebral palsy and proven to be effective.
Squeeze my finger and let him out. Oh, get it, get it, get it. Good girl, we're almost done.
Sometimes the process goes slowly, and sometimes it goes remarkably rapidly. When it goes rapidly, it's almost like a miracle.
Michael Bernstein is now back at work using his hands in very fine motor activities.
I only spent 10 days of therapy with Dr. Taub, and the result was amazing. Okay, sit back. I could almost sense that each hour of doing a different task, I improved. I couldn't make that movement, or that movement, or that movement, or that. Simple movements that are required in daily life that you couldn't do because of the stroke. Okay, sit back. I hadn't touched the piano in 41 years, and I decided to get this performance together, and I sent out invitations and invited Dr. Taub and his wife.
The bottom line is that you can't teach an old dog new tricks. That principle is at the heart of a revolution in rehabilitation.
One of the most important lessons I learned on this quest to understand neuroplasticity is something I call the plastic paradox. The paradox is this, that the same plasticity that allows us to change our brains and produce more flexible behaviors is also the source of many of our most rigid ones. All people start out with plastic potential. Some of us, as we grow and develop, enhance that flexibility. For others, the spontaneity, creativity, and unpredictability of childhood gives way to a routinized existence that repeats the same behavior and turns us into rigid caricatures of ourselves. Anything that involves unvaried repetition, our careers, cultural activities, skills repeated, and neuroses can lead to rigidity.
For a while, people had this notion that plasticity must be a good thing. It's a good thing that the brain can change because we can learn new things, and that's true. But if plasticity is an intrinsic property of the brain, it's neither good nor bad, it's just the way it is.
Alvaro Pasqualiani is elegant, charismatic, warm, mellifluous, expressive, and whenever he does something, he radiates a very serious sense of playfulness.
Just going to start with a relatively low intensity so that you have a sense of what it feels like. I've done this enough that I have a sense of where your motor cortex is going to be. TMS stands for transcranial magnetic stimulation, and it is a way to stimulate, to apply currents to specific parts of the brain, but without having to cut open the skin, crack open the bone, and expose the brain.
Oh wow, that was my bicep.
Sort of the biceps movement, right? That's sort of more your little finger. You know, one of the things that we've learned from TMS is that we can use it to map the brain. We can use it to understand how brain activity relates to behavior. We can also use it to modify the brain. We can use it, depending on the parameters of stimulation, to actually increase activity in a part of the brain or to suppress activity in a part of the brain. So I'm just going to target your language area. That will give you a little feel of what it is like when people are trying to speak and can't because of a stroke in that area. Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9. It's getting tough. I was still slurring my speech.
Pasqualiani is now expanding his work to look at the autistic spectrum, which includes the childhood disorder of autism and Asperger's. And his working hypothesis is that they're both a product of hyperplasticity in the brain.
If the brain is plastic, and we believe it is, can plasticity itself, can the mechanisms of plasticity themselves be abnormal in certain conditions? Could it be that one has too much plasticity? And we think that autism spectrum disorders are exactly that.
There are certain things in autism and Asperger's that involve a hypersensitivity, and he's wondering whether these hypersensitivities are related to a very overconnected brain that's formed many, many plastic connections.
So that autism can generate an abnormal plasticity, an excessive plasticity, in fact. When the brain is excessively connected, it doesn't function well. There is recurrent thoughts, there is intrusions of thoughts, there is repetitive behaviors, ritualistic behaviors. If we are right, if the hypothesis is correct, then we would be able to use the capacity of brain stimulation to modulate activity, to suppress that plasticity tendency, and therefore, hopefully, to help with the symptoms of disease themselves.